Hi everyone and welcome to Crushing Doubts Q&A. We are weekly every Monday usually, but we're actually announcing a switch. We are moving to Thursdays. It will still be at 6 p.m. Eastern, 3 p.m. Pacific. So starting next week, not this week. This week we're Monday, of course. Next week we begin on Thursdays. I needed to adjust some things in the schedule, and that's going to help me out. So hopefully that's not too bad for those of you out there. Maybe it's even better as you get later in the week. You can devote more time to it. Or if you're in England, you can stay up later. All kinds of options, but hopefully Thursday at 6 p.m. will work for you. 6 p.m. Eastern, 3 p.m. Pacific. So, as always, we are here to answer all your mind body questions. My whole foundational system is based on the fact that you need to get your questions answered to your satisfaction. And sometimes that even means getting your questions unearthed. So we need to think about how to think about these questions, how to get them answered. And there's many ways to do that. The Q&A obviously helps in many ways. But if you're having trouble, please email me, dan@crushingdoubt.org. We have the seminars. We have the group memberships. The group memberships are where you kind of practice the system. And the seminars are where you learn about the system in general. So many ways to go about this. Let's get into any kind of questions that you guys have. I do want to say hi to a couple of people. We've got Carrie Nordling has joined us. Ray DeLand has joined us. And Michelle has joined us. Sandy Miller has joined us, all on Instagram. Jane Smith has joined us on YouTube. She says, hi, Dr. Dan. Thanks again for being here and for identifying and then so highly spotlighting doubt as such a central driver of pain and what I was obviously missing all these years. I'll just bring it up on the screen, her very lovely comment. Jane, thank you so much for your appreciation. It's very gratifying to hear, and it also does highlight something really important as far as I'm concerned, which is that one of the reasons we're finding success in the Crushing Doubt community is that we are bringing to light an issue that really hasn't been highlighted much in the mind-body community, or not enough. That's what I found in getting better. When I read Sarno, it was a revelation, and he did save my life, generally speaking. But I had a lot of questions, and that is how I discovered the importance of doubt. He gave me the first inkling of it in saying that understanding and accepting the diagnosis without any doubt was key. What I didn't know is that extends to everything. The more we can make sense of things, the better off we're going to be. So Ray DeLand has a question on Instagram, and I'm going to actually just bring this question down so we're not confusing questions. She says, do you think certain symptoms take a certain time to resolve no matter the mindset? Are you able to see patterns within chronic migraine after COVID? So first of all, the frown face tells me that you are dealing with that yourself. COVID itself was very hard for some people. Certainly, it was for me. I had it for 17 days, and I thought the whole time about mind body issues. How much of this was what Sarno called TMS? And of course, COVID is a real thing. It was a totally real virus. I tested positive for it for days on end. I had all kinds of symptoms. I did not have migraine, thankfully. But after COVID, there's a lot of people showing lots of different symptoms. And I know there's a lot of debate about, well, what is long COVID? How do we think about it? My way of thinking about it is that it would be very hard to distinguish long COVID from a mind body condition, because mind body conditions can pounce on any thinking that you have whatsoever. And we're going to have a lot of thinking when we have a condition like COVID, where there's been so much talk about it and so much fear and so many expectations, and they're all in different directions. How could we not have mind body symptoms? Virtually everybody who has COVID also has mind body symptoms. The question is which is which. And I'm not meaning to suggest that COVID symptoms are not real, because they are. Secondly, mind body symptoms are real. They just come from a different source. Then there's overlap that can happen. So I believe this is Rebecca. Good to see you, Rebecca. So it's actually not Ray DeLand. It's Rebecca Idland, I think. So sorry about that. So Rebecca, I'm sorry you're suffering that way. What I have found is that certain symptoms do not hold on any longer than any others. That is something that means that there is doubt there. And I certainly understand it. So sounds like I got your name right. Okay, good, Rebecca. Sorry about that. Sometimes it takes me a while to process this. So you said it's been 5 months already for you. That is a very, very long time to be suffering in any way. But I will say that mind-body conditions tend to hurt more than anything that I've experienced at all. So having that kind of suffering for that long is really, really, really hard. The good news is this. In my experience, there are no symptoms that last longer than others. The only thing that makes them last longer than others is doubt. So, Rebecca, you've got a bad case of doubt, and I want you to come work with me if you can. Certainly, we can talk about it in any way that you'd like. But if I can convince you to either do the seminars or come to the groups or both, then I can work with you on this directly. I will say this: there are certain symptoms that have more of a reputation for hanging on, and that tends to contribute to more doubt. And migraines are one of them. But I just watched a video from John Strax and his wife. She had chronic migraines. She treated it with a mind body way of thinking about it. They're gone. She doesn't have them anymore. You can get rid of all of these symptoms. They all can be gotten rid of fast if we have the right belief system. It's just not that easy to believe always. So I totally get that. It's partly my job to help you get convinced of that. So, Rebecca, Dan at crushingdoubt.org. Let's connect. You've been suffering long enough. I really want to help you with this. Okay, we have another comment coming in from Jane Smith. Jane says, when I have an uptick, how long should it take for me to try my emotions column before moving on to the doubt column? 5 minutes? 60? If it's just a couple of minutes, could you please give a demo? Okay, fantastic question. And by the way, this is the exact kind of thing that we could go through in the groups very well. And the advantage of the groups is that I won't just give an answer. Then you could ask questions and you could say, wait, what about this? How do I think about this? There's a lot more give and take, and it's much more rapid in terms of getting you the information. So, Jane, I'll give it to you this way. I had an emotions column symptom this morning. I woke up this morning and I was very tired, and I was thinking, oh, maybe I'm just dragging. It's a Monday, whatever. Various reasons that it could be. But I started to think about, this as maybe a symptom as it dragged on. It dragged on for a couple of hours. So, Jane, how long do you have to think in your emotions column before maybe moving on to another column? Well, it depends on when you started thinking. I didn't start thinking of my emotions column for several hours today, and I was having like a brain fog. I couldn't concentrate. I just felt really out of it. And it was only when I decided, let me look in my emotions column, that I started to get some relief. What did I do? I looked in the emotions column, and usually if you're really well versed in the emotions column, you probably would only need a couple of minutes to be able to recognize it. But it really depends on the symptom. If the symptom's dragging on, you could look in the emotions column for 60 minutes. You could look in the emotions column for 2 days even. And I'm not saying it's going to take that long. I'm just saying use the columns and their function to know which one to look in. If you had an onset or an uptick, I wouldn't go to the doubt column. That's behaving like the emotions column. So if you're not finding it, it just means you're missing it. It doesn't mean you got to move on to a new column. The doubt column is there for symptoms that have been dragging on, like Rebecca's symptom. That's a doubt issue. It's been 5 months. It's way past that emotions column entry point. So that's a time where I'd want her to move on to doubt. If you're looking in the emotions column, though, and you're not finding it for, I'd say, 2 weeks, definitely time to start looking into doubt, because that's really kicked in. However, the timing of the symptom matters. And if it's an onset or an uptick, you got to look in that emotions column. That's a little bit of a demo. What I ended up doing this morning is I realized, I went through my different themes, the kind of things that could come up. The one that hit me was mortality. My birthday's coming up. No obligation to say happy birthday. I know a lot of people do that when I say this, but I'm only bringing it up to show you as an illustration. The minute I hit on that idea, I got kind of sad. And then the brain fog and everything else went away. So I did actually use the emotions column to take away a symptom. Generally speaking, I find when you're really well versed in this, under 5 minutes, you're often going to be able to get it, as long as that's where you're looking. But before you're well versed in it, it's going to take longer. And I would just focus on the function of the symptom. If it's an onset or an uptick, keep looking in the emotions column. Okay? All right. Jane, let me know if that helps. Happy to follow up with more questions, because that's more answers, because that's kind of how this all goes. More and more questions. Okay. Haley Parr has joined us on Instagram. Scotty Styles, good to see you. Always such a lovely greeting from you. And it sounds like Rebecca knows Scotty. Rita's joined us as well. Good to see you, Rita. And Andy RY has joined us as well on Instagram. Okay, we have a question coming in from Michelle. Michelle, it is good to see you here. I've been on the distraction bandwagon lately as I struggle with symptoms that have ramped up. I think there is an increase secondary to intense emotional therapy. What are your thoughts? Is using these distractions potentially increasing doubt? Okay, this is interesting. A lot of times when I read a question, I need to go back and reread it. And it's not because I wasn't taking it in or didn't understand it. It's because there's a lot of nuance in your questions because I'm trying to think, how's your mind working? And the whole point is this: however your mind is working, that's what you're dealing with. So I like to read it again sometimes to make sure that I really got where you're at. So I've been on the distraction bandwagon lately as I struggle with symptoms that have ramped up. Okay, so I actually had a question for you, Michelle, before I answer this. Does the distraction bandwagon mean that you feel like you've returned to what were kind of emotions column symptoms? Because a lot of times when people talk about distraction, it's used in that Sarnonian kind of way that it's distracting from an emotion. Are you saying you think you've got emotions going on uh, that are leading to the distraction? I think that is what you're saying because your next sentence is, I think there's an increase secondary to intense emotional therapy. That is very common. So when you ask me what are my thoughts about that, it's incredibly common to have responses to therapy that are emotional in nature. If you know those themes well, and of course I can help you process some of those if you want, we can get to what's the nature of this. Now, as you know, that's going to hurt emotionally. You're getting at the heart of it. But at least it can then take away the symptoms and then give you a chance to deal with the emotions. Same thing that happened to me today, recognizing my birthday is coming up and that I have some sadness about it in some ways. My birthday is often connected to some sadness because when I was born, my father died, and there's a whole stuff like that. But it's not just that; it's also getting older gets harder in certain ways, and the mortality ideas, even though I know I'm relatively young, can really kick in. So when you're having a big emotion, it can lead to increases in symptoms. And if you're going through an emotional therapy, those emotions can go through the roof and bring those up. But if it's a true emotions column symptom, Michelle, you'll be able to pinpoint it, sometimes maybe with my help, sometimes on your own, and bring that down. So don't let doubt start to creep in that you can't get this. You can. The one caveat, which I'm sure will not surprise you, Michelle, because you're well versed in this and you know, is that when you are processing things really, really deeply, you're working in the power column. And in the power column, you can often have symptoms go up when you are experiencing the emotional events of the moment in a way that's different than emotions column work, where they will evaporate when you become aware of them. In the power column, becoming aware of them is the processing the fullness of your trauma. It's where you start to get a sense of what really happened to you. And so as you continue to go through some of that intense emotional therapy, that can go up. Now, your last question was, is using these distractions potentially increasing doubt? Well, listen, if you're actively letting yourself use the distractions, that's totally okay. But anytime that, remember what doubt is. Let's start there. Doubt is fear, confusion, lack of certainty, and questions. Questions are kind of the gold standard in the doubt column, but A questions, where you're asking questions that are designed to get you a further understanding of things. If that's happening, you're moving in the right direction. But confusion's the one I'm kind of locking in on here. If you're starting to feel like you don't have a clear picture of what these symptoms are, where they fall in the columns, then I do want you to back up and look at those columns again, because it could be increasing doubt. Anything that breeds confusion or leaves you with unanswered questions, it does increase doubt. So I'm not saying it's a bad thing. It's just something to understand. Michelle, let's follow up. And I just want to make sure I answered your question well enough. So please do let me know. Rebecca Idlin, you asked when the groups are. The groups are currently Mondays at 4 p.m. Eastern. I'm just listing in Eastern time because that's where I am, but we can adjust with the time zones as needed. But Mondays at 4 p.m., Wednesdays at 12 p.m. Eastern, and Fridays at 12 p.m. Eastern. We are considering moving Fridays to 2 p.m. Eastern. I'm trying to get different times for different people. I'm even considering opening up a time that would be more like 5:30 p.m. Eastern, because I know a lot of people on the East Coast have hours that they need after work. I'm trying to keep times open so that it works for West Coasters, people in England, even people in Australia, people after work. I'm trying to get people different options. But in any case, Rebecca, you can also find those group times listed on the website. It's www.crushingdoubt.org. And you can email me if you have questions, dan at crushingdoubt.org. Okay. Rita said, hi, good to see you. Okay, now, Michelle said in response, I think that it is all emotions, but I think that I'm more concerned with the use of distraction. Okay, so I think doubt is coming in to make you think, the distraction is going to make it worse. So what you have going is a double whammy. You've got the emotional load from the therapy work, and that's leading to an uptick. Totally agree with you on that from the sound of things. And then this worry, is the distraction bad? Ironically, that's doubt getting you worried that doubt's going to play a role. It's like a meta doubt. Doubt is always going to try to climb in some way. So, Michelle, let's follow up on that now and see if that fits with what you know. As I tell everyone, I have a way of interpreting the columns and what's going on with you, but you're the only one who really, really knows. So, when I say something, if it vibes, you'll know. If something doesn't feel quite right, we keep visiting it. Okay, Michelle said yes, yes, and yes. So I think we're on to it. Let's keep at it, Michelle. We've got the right conceptualization. Let's bring down the doubt and just remind yourself it doesn't matter if you have doubts for some moments. We're always going to be able to bring down doubt in the long run. And then we'll get to what these emotional things are. And I'm happy to work with you on it. Okay, Catherine Toomer has joined us on Instagram as well. Good to see you here, Catherine. Okay, a couple questions coming in from YouTube. Okay, Chrissy Lynn Eden says, Dan, what do you do if you've had a ton of tests, but you still believe something is wrong physically or that they missed a disease? What if you believe the MRI, but then you think things may have gotten worse and you feel you need new imaging constantly because the symptoms are getting more scary? Okay, thank you for this question, Chrissy. I certainly understand where you are, not only where you're coming from, but why it's such a terror. When you can't get settled on these things, it gets really tough because ultimately you do have to come to certainty about that. And here is the question: how are you going to come to certainty about it? Well, that question is going to open up some other questions. So here's what I'm thinking, Chrissy. What we need to do is actually ask you to kind of brainstorm with me. Why do you still believe this? What is the central thing that's making you believe it? As an example, you could say to me, it just feels so real. Well, that's the kind of thing I hear all the time. First of all, mind-body symptoms are real. They're actually happening in your body. There's all kinds of physiological things happening from it. So that would be one doubt that we would need to look at. Ultimately, what we're talking about here is getting doubts articulated. When I talk about the doubt column, we observe doubts, articulate them, and counter. What do I mean by that? Observing doubts means to call it into question, to recognize that we think it's true when really it might not be. So that's something that I'd challenge you to do first here. You're saying, listen, I know the tests are saying it's fine, but I think they missed something or something really is purely physically wrong. You have to call that into question. I'm not saying you have to agree that I'm right, that it's not that, even though I'm certain myself. It doesn't matter what I think. You're burdened with what's going on in your mind, not with what I think. So first, just call it into question. Consider, maybe I'm wrong about this. And I don't have to decide one way or another, but let me just open the door for that. That's what observing doubt is. Then we get it articulated. We put it into words. We talk about, what is it that's making you still doubt it? So it could be that you believe, for example, that nothing's ever certain. That's my doubt. Well, then that's the doubt we have to deal with. Or it could be that you've had the experience of doctors missing things before, and it makes you believe a certain thing about doctors or about what people can see or whether they can be trusted. Well, that's a different doubt. So we have the primary job we have here, Chrissy, is, if you can call it into question first, observe it, is to articulate it. We have to figure out why. Now, it could be that there's a particular finding on the MRI that they say is no big deal, but you think is. Well, if that's the case, we have to articulate what is the doubt that's bothering you. Once we figure that out, then we can start to play around with it. We can start to challenge it and wonder, okay, why do you believe this? And how do we think about this? And you may be very surprised at some of the things you would hear from me that could be very convincing. Part of my program is designed to answer these doubts. And you haven't gotten to do it yet, really, exactly. We've had some interactions, but when you get to have more interaction with me, I can really tear some doubts apart in a good way that can help you. So you're raising what I would say is kind of a more generalized doubt. I want to get a little more specific about this because if we can get specific about it, that is where, in the details, that's where doubt falls apart. That's where its theories really fall apart. Chrissy, let me know if that made sense to you. We'll follow up on that. Okay. Michelle, I see you said, let's talk about this on Wednesday, please. I'm all for it. Good idea. Okay. I Love Myself has joined. I love that name. Let's spread the word. That's something we all need. Okay. Dorisa says, hi, Dan and everyone. Good to see you here, Dorisa. Dorisa and I go way back. It's very good to see you here. Karen Isaacs says, and this is a response to Rebecca. Yes, Rebecca, you can rid of migraines. I'm proof. I had them for 43 years. I had 43 years of them. When I found Dr. Dan / Nicole Sachs, all this info clicked for me in a way that I never heard being a Dr. Sarno patient for 25 years prior. So Karen, first of all, thank you so much for voicing that in multiple ways. One of the reasons that I'm really glad you're voicing it is it highlights the fact that we can know all about Sarno and the mind-body process and still just not have it click in a way that really works for us. What Karen's saying is when it clicked for her, and she discovered Nicole before me, so something clicked in the journaling with Nicole. And then some further things clicked with respect to doubt, I think, primarily, but actually also the power column quite a bit, Karen. When those things clicked into place, it made sense to her. And that's really what this is all about. We need it to make sense to you. It doesn't matter whether it makes sense to me, except for me. I can alleviate my symptoms from how I believe things. But if we can get you to really feel like you get it exactly, that is when things shift. Okay, follow up from Karen. She says, for me, doubt was the biggest issue because headaches were more scary than any other. I totally appreciate that comment for multiple reasons as well, Karen. One of them is that headaches do tend to be, first of all, very, very scary for people, but they also have a reputation for being hard to get rid of. It's kind of how we think about migraines. I mean, the word migraine sounds like and is talked about as a headache that's very hard to get rid of. I totally get it. What we need to do is challenge that all symptoms can be made to go away just as fast as everyone else, as every other symptom, I mean. So ultimately, this is for you, Rebecca, because you're grappling with this right now. Karen's gotten past that particular one. I have to help you challenge it. That's the observing doubt that I was talking about with Chrissy. Observe it as doubt. Call it into question. I know it's been there for 5 months, but you know what? That doesn't necessarily mean that it's because it's harder to get rid of. It could just mean, and I think this is what it means, that doubt is stronger around that symptom. So, Rebecca, let me know if that makes sense to you, and we certainly can talk about it. Okay, Elizabeth Baggish says, an MRI showed many spine issues. Although I have had some progress over 2 years, an inability to sit for long isolates me. How can I get rid of MRI doubt? Spondylolisthesis, always one of the harder ones to say. Stenosis, do not heal. Okay, Elizabeth, we can have lots of conversations about it, but I'm going to get us started. First thing I'm going to do is give you some information, and then I want you to push back because, as always, I can give you guys information, but if it's not doing the trick for you, I mean, look at what Karen just said. You could be going on for 25 years. If it doesn't click for you, it doesn't click for you. So I want you to push back when it doesn't. My job is to answer it to your satisfaction. So here's the first thing I'd say. There are countless studies, many, many studies that show directly that spondylolisthesis and stenosis, they may not be able to heal or change, but that they do not cause pain. They're completely irrelevant to pain. If you have any doubt, go to the PPDA website. It's www.ppda, I think it's ppda.org. I need to check on that. I should actually know that, especially since I just joined their board. But PPDA, the PPDA, if you just Google them, They have a bibliography of tons and tons of studies that show that herniated discs don't cause back pain, that arthritis has no correlation to pain, that all of these structural issues do not. Now, Elizabeth, I don't know if you have had access to those yet, but they are definitive scientific proof that these MRI findings, while there, are actually totally irrelevant. That is the first place I would go. Now, we'll have to see how that sits with you because ultimately, as I said, doesn't matter what I think, it matters what you think. But that's the place I'd start. And, I want to challenge each and every one of us to be very scientific and logical. We're our own scientists. So if I tell you this information, I don't expect you just to trust it necessarily, but go check it out. You will find I'm right. In fact, if you Google, do herniated discs cause back pain, as an example, you will find two types of articles. You will find articles that disprove scientifically in clinical studies any correlation between herniated discs and back pain. And you can find it with spondylolisthesis or stenosis. So search for those as well. You will find that there are scientific studies that show there's no correlation, or there are doctors who say that they do cause that with no notations, no references to any study. There are no studies that support this. So let's start there, Elizabeth, because just with the science, right at the base, you will find that this pain you're having, while totally real, is actually mind body, does not have to do with these conditions. I know hundreds, if not thousands of people who have gotten better while still having these conditions. And that can't happen if they're the cause. So let's keep at it. Elizabeth, let me know if that helped you. Okay. Teresa says, can you explain distraction versus living your life? Okay. Well, I'll try, Teresa, but words can mean different things to different people. So one thing I would say is this: in the mind body world, distraction usually is referring to the Sarno's idea that the symptom is a distraction from the symptom. But I think what you're getting at is simply, um, doing things. And maybe this may be related to what Michelle was saying. When you're just doing things and you're active and you kind of forget about the symptoms, that could be seen as living your life, or it could be seen as, well, is this just a distraction? And then what happens when you stop? And Michelle, I know that's something that you've grappled with in various ways. So maybe that is what you were referring to more than the Sarno kind of distraction. Sorry, I probably should have picked that up. So I think the idea is this. I don't actually think of it as when you are living your life and kind of forgetting to have the symptoms or be aware of them, that you are actually having the symptoms, but you're just distracted. I actually think the symptoms are shut down during that time. They're not there. If they were, you'd be feeling them, and it makes sense. If you have a really tight muscle that's causing so much pain, no amount of distraction is going to make a difference. So I think that those symptoms are actually going away. So you are living your life at that point. I think the distinction that Doris is wondering about is some people say, well, no, I think the symptoms are still there. You're just distracted. I don't believe that. I think the symptoms are truly not there during that time. And then when you return to your life and you're not doing that supposed distraction, that's when they come rushing back in. Okay, one more question from YouTube, and then I'm going to get to you, Catherine Toomer. Thank you for your patience. Patty Clark, it's good to see you. It's been a while. Okay, what if the nerve pain is consistent daily, 24/7 for 6+ years? Patty, that can not only can that be TMS, it's actually 100% certain to be TMS. There is no nerve pain that I know that lasts for 6+ years and is always there, unless there was a catastrophic, obvious event. As an example, I was taking an Uber, and a guy was telling me about his back pain, and I said to him, "Oh, well, I'm actually a back pain specialist." And I talked to him about what I do, and he was like, "Oh, mine's a different story." And I thought, yeah, this guy's just not open to this. Then it turned out he had been shot with a bullet that was still in his back. That was causing the kind of nerve pain that can last for 6+ years for non-mind body reasons, even though he probably had some mind body issues as well, because how are you supposed to live comfortably like that? Patty, unless it's something really obvious, like a bullet to the back where the bullet's still there, this is mind body. Then again, It doesn't matter what I say. It only matters whether it makes sense to you. I just want to reassure you that it lasting for that long that doesn't worry me at all as a non-mind body thing. My back pain was for 8 plus years. And, you could argue that a lot of that was nerve pain, and some of it even was. There were, nervy kind of feelings throughout. And it was for 8 years. So you got nothing to worry about in terms of your ability to recover from this. It's the same thing. But again, we got to convince you. Okay, Karen Isaac says, Dr. Dan's confidence gave me confidence, which made me feel, I think she said, more. Actually, I don't think there is a follow-up to that. Okay, so I think, though, I can speak for you, Karen, because I know you well enough. My confidence does go a long way for people. That's what Dr. Sarno did for me. His confidence was so important, and it's really interesting because I feel like a lot of people, they took his ideas, but they didn't take his way. And his way was super, super confident. And I knew how important that was. When people come to see a mind-body specialist and they say, I'm 99% sure that this is mind-body. I don't know what you all hear, but I'm pretty sure it's the same as me. I hear I am 1% not sure. That's what I hear. That's what any doubt-related person would hear. So the confidence does help. I will keep bringing it. I'm certain of these things. I also know where it begins and ends. I've answered all the questions for myself. I'm very comfortable sharing them with you. Full Flourish, welcome to Instagram here. Thank you for joining us. Okay, Catherine, thank you. Oh, Alex also. Alex JHS. I didn't see that you had joined as well. Welcome. Okay, Catherine Toomer says, hi, Dr. Dan. Two things were particularly helpful last week, and I'm trying them out. One is the idea that for me, it is a power move to saying I do not have to go to the worst case scenario in order to figure out what's going on inside me and get beyond pain. In fact, I should probably always make that choice. That would be very powerful and change my life at least a degree to the better. Probably way better. I agree, Catherine. I think the idea of the worst case scenario as some kind of either a badge of honor or something you have to do to get the right information, these are things we've got to fight through. That's actually a doubt. You observed that doubt now. And by observing it, you can make a different choice. And you are making a different choice, and it's already better. Okay, the second very helpful thing from last week was to treat oneself as only an emotional being during those moments when a pain is getting us down, like feeling a joint pain. And instead of saying, ooh, my knee joint hurts, saying, ooh, I'm still feeling anxious about entering my 70s. Bingo. I love that. This is what I mean when I say your body is a flowing emotion. I think of myself as not even really having a body per se. I only really come back to my body when something comes crashing into it. I think of myself as a flowing emotion, and it does really change things. I also think of it specifically when I'm like, let's say I'm having a mind body pain and I'm getting up and I'm going to think, oh, this could hurt. Right then I say, no, I'm an emotional being. What am I thinking about? How am I feeling about my daughters? How am I feeling about my work? How am I feeling about my wife? How am I feeling about where I live? How am I feeling about my friends? How am I feeling about my family? Thinking emotionally is the place to be. And this is another reason I say live in the power column. It's a way to live in a kind of more emotional way that's connected to your full picture. Catherine says, thank you, Dr. Dan, for these ideas and many others. You are most welcome. I'm glad they are working for you. I will keep the ideas coming. And not only will I keep new ideas coming as they come, but there's lots of consistent ideas that I'm going to say again and again, and that's helpful. The confidence helps, and so does the repetition sometimes. Yasin Flo 44 has joined us on Instagram as well. Good to see you here. Thanks for joining us. Okay, Armand Johansson says, hello, Dr. Dan. I have a trouble, and I doubt if it's a new TMS thing. Usually I go to the osteopath every 3 months now because I feel stuck in the back. But now I've been doing for a month 3 sessions because my body didn't want to unstick. And I don't know if it may be TMS. There's some follow-up here. But I fear that if I train with my back stuck, I'll feel pain. But I don't want to do 1 session more. Even my osteopath tells me to stop the sessions with her. Okay, so first thing I'll say, Armand, as always, it's not going to matter what I say. It's going to matter what you think about what I say. But This is a mind body issue. This is not something new. If you're stuck, it means there is in this case, doubt because you've had it for a while. If it were something brand new, I'd be looking in the emotions column. But I've talked with you enough to know that you've got doubt that is raging, is very strong, and you need someone who's going to help you conquer that regularly. And that is part of the reason I recommend seminars just to get the idea of the whole system, then come to the groups because in the groups, that's part of what I do. I reassure again and again with information, but also with a lot of strength. I explain why I'm thinking that. And then if you're like, well, but I'm not sure because of this or this makes, there's a lot more give and take in those that can help you get at this. Um, I wouldn't want you necessarily to go training with this because you have a lot of doubt. But the fact is, in a mind body condition, one thing you can be clear on is it may hurt, but it cannot harm. Nothing bad is going to happen to you, no matter what you do, especially if you are willing to come to the table to talk about these doubts. We can master these things. The three columns have been they've been incredibly helpful to me personally. It's one of the reasons I pass it on. And of course, I formulated them before I even had them as columns. But when I looked back and understood what I was seeing and doing, that's what formed the columns. We can look at these columns and get all kinds of symptoms under control and changed. And that is what I want for you. So you're not going to harm yourself, but I do need to help you see that you are going to find your way out of this. And I need to show you why. I need to tell you why I'm so certain that this is a mind body thing. And there's lots of different ways to do that. Ultimately, it comes down to a long conversation. Not even long necessarily, but it comes down to a conversation. Sometimes it's short. Sometimes people get the kind of quote unquote cure very, very quickly. And other times it takes a little more discussion. Usually, though, I find people get a lot of results pretty quickly. So, Armand, I want to keep having a discussion. Keep bringing in here if you need to. Email me at dan@crushingdoubt.org. Do the seminars, come to the groups, whatever it is that you need. I want you to commit to getting the knowledge you need. It's one of the reasons my system's a little bit different than some of the other mind body systems. They're all designed to give you certain amounts of information. My system, you can say what you want about it, but it is designed, at least this is the intention, to get you the full answer for you. So you know exactly what's going on and how to think about it. All right. Elizabeth Baggage says, thank you. A fear thought is that individual people have different reactions from similar conditions. I will check these out. What is the website again? Okay, my website. You must have been talking about PPDA. I will pull that up. My website is www.crushingdoubt.org. Give me 1 second. I'm going to pull up the PPDA website because I really should know that anyway. 1 second. Make sure this is it. No, that's not it. All right, I'm gonna find where it is, and then I'll put it in the chat. That takes me to some kind of PPDA association. That's what it is. So this is the Psychophysiological Disorders Association, and that seems to be the wrong one too. All right. Give me 1 second. Well, it seems like their website is currently having some issues. So, in any case, I would Google PPDA, Psychophysiological Disorders Association. They have those. I also have a link that I can send to you. So just send me an email, dan@crushingdoubt.org. I'll send you the link. That link is also on my resources page on the website. So go to www.crushingdoubt.org and you can get that there. Okay. I see Ross the Boss has joined us. He is my co-host on my sports shows. He's joined on Facebook. Good to see you here. And he has a comment. He says, just got back from the gym and was squatting a lot of weight. Felt fine when I was at the gym, but now my knee is sore. Thoughts? This is a really important kind of topic. And thank you for bringing that, Ross. When I play basketball, I do find that my level of soreness is highly varied in ways that are suspect. You would think that playing, over 2 hours of basketball would just leave you sore naturally. But you know what? When I really looked at it, when I observed doubt and called it into question, I found some pretty surprising things. And one of the things that I found was that my my soreness was incredibly variable. And the fact that it wasn't sore at the time that I was there and later, lots of people say, well, that makes sense. It's like the lactic acid buildup, it comes later. Okay, that's true. But if you really look at it and you start doing a science experiment with yourself, you'll find it's not actually true. I used to find that I was sore the next day all the time. Then when I started challenging that idea, I started getting sore the day of, but not the next day. Then another time I came home, there was something stressful going on at home, and I actually forgot to hurt. I'm going to say that again. I actually forgot to hurt. You can't forget to hurt if there's something going on purely physiologically. So I think what's going on here, Ross, is that we have a belief system that we carry with us. And Ross is saying more. He says, I feel the older I am, the harder it is to not be sore. Anything I can do mentally to not feel the pain. Okay, I have definitely found this is not the case, but that's the belief system. This is what I'm talking about. So when it comes to whatever we're believing, it is more likely to be enacted in a mind body sort of way. And how are we not going to believe that it becomes harder to not be sore as we get older? That's what we're taught. We're taught that everything gets worse as we get older. And some things do. Our reflexes get worse, our eyesight gets worse, our hearing gets worse. These things do happen some, but I think it probably is somewhat over exaggerated. But we're carrying those beliefs with us, and it's causing actual soreness. It's causing all kinds of things. Sarno had a really interesting point about the responsibility years, which is between the ages of, say, 30 and 75, something like that. People had much more chronic pain than they had before that. And before that, people would argue, well, but they're younger. But if that's true, how come there's a lot less of these pain and other symptoms, kind of after 75? When people have retired, they have less responsibilities. They can get symptoms from being retired and from not having responsibilities, but it's less common than all the demands. So what we're really talking about is let's at least bring it into the picture that we have a belief system. And that belief system can feed a lot of things that go on. Okay, Teresa says, that is what I thought and tell people that are living their life. So I couldn't agree more, Teresa. I don't think it's about distraction. Okay, Patty Clark says, thanks. You are welcome, Patty. I'm happy to talk with you more about it as needed. Karen finished her thought. She said, let's get back to it. She said, Dr. Dan's confidence gave me confidence, which made me feel powerful. Okay, thank you for saying that, Karen, and I'm so glad. Okay. Diehard Patriot 3, that's Joseph. Good to see you here, Joseph. It's been a while. He says, hi, Dr. Dan. Long time no talk. Yep. Hope you're well. What's your opinion on using downer meds for people with TMS in the desensitizing process? Why isn't this more popular? Interesting. Okay, hold on. I think you have a follow-up. I just want to make sure that it's not about this. No. Okay, so I'm going to answer this first. So that's interesting. First of all, I'm always particular about my language. And one of the reasons that I'm particular about language is that language is powerful. So, and I'm not saying you said anything, Joseph, that, I'm zeroing in on necessarily, but when I see certain words like desensitizing, I'm very aware that in parts of either the mind body community or certainly in medicine, when medicine has caught on to the idea that the mind does affect the body, they've unfortunately continued to enact certain things that I think contribute to a lot of doubt. And one of them is this idea of central sensitization, meaning our nervous system is all revved up. And so I think that's part of what Joseph is asking. Well, what if we use some medication to just calm things down if that's supposedly so much of what is going on? Well, your question, and I think this is what you were thinking about, Joseph, but you'll have to let me know. I think Joseph is recognizing if it were so easy to do that, why wouldn't we just do that? And I don't know if that is what you're saying, Joseph. I'm reading into it, but that's what I think about it. If it were so easy, that should work. 100%. One of the things that was very convincing to me about something is when I was having back pain and I took actual muscle relaxers, I spasmed straight through them. If that's true, then, I know the medication works to relax muscles. That's what it does. But clearly something else was going on that was overriding it. And that's what's happening with the supposed desensitizing process. It's not that we are oversensitized and we just need to dial it down. That's not what's happening. What's happening is we are oversensitized because feel we are in danger. If we are perceiving danger, we're going to have that revved up. And even if you take medication, you'll be, it's kind of like you could be anxious and drunk at the same time, as an example. It's the same thing. What we really need to do is bring down the fear process by not being afraid. And how do we become not afraid? We have to become not afraid by getting the right information. Okay. Tula Fay says, I hope I said your name right. I'm sorry about that. She said, wow, just what I needed. Thank you. And I'm pleased that you got what you needed. I don't remember which part was what you did need, but I'm just glad you got the information you needed. That's what we need to keep up. Okay. Diehard Patriot. So Joseph says, makes logical sense that it'll help blunt the resistance felt by people challenging their TMS, as the body never relents without a small fight. I do agree with you about that, Joseph. And so I don't think there's anything wrong, by the way, with taking the medication. The question is it going to work? Okay, Karen Isaac says, I always felt hold on. There was a little typo there, I think. Hold on. I would say I don't want to deal with my rage. Okay. It hurts too much to deal with, but I now know it hurts too much to not deal. I like what you said about not having a body. Yeah, it's a really helpful thing for me to just feel that my body's a flowing emotion. And that includes the rage. I like to feel like, well, my body is just expressing that. Rita said that happened to me too. The pain management doctor told me that was scientifically impossible. LOL. Hilarious that a doctor tells you something scientifically impossible when it just happened to you. I think we can all say we know what happened to ourselves. Let's use good science. It's terrible science, which is why Rita's laughing, to say that something is scientifically impossible that just happened. That's incredibly bad science, which I know, Rita, you totally agree with. Okay. Ryan Edson said, can I do a drop-in session on Friday for the group? I have a day off work. Also, 5:30 p.m. Eastern time would be one I could make, being on the West Coast. Okay, let's talk about it, Ryan. Email me, dan@crushingdoubt.org, and we'll work something out. I want to get you guys the help you need. Dorisa says, repetition is so important. Our minds and brains take time to absorb. Thanks again, Dan. Thank you, Dorisa, and I do completely agree. It can really help to go over these things. We're going to take a couple more questions and finish up for the day. But what is Armand Johansson says, but what is really weird is that my osteopath does feel the stuck stuff in my back every new session. Armand, what you need to remember is that mind-body symptoms make it real in the body. They make it actually happen. So all that stuckness is real. It's there. The question is why. So if it's for mind-body reasons, then you could do any amount of manipulation and it's not going to move. It's only going to move for the right reasons. And so for mind-body reasons, I can help it move for those reasons. Let me know if that makes sense. Okay, Patty Martin, good to see you here. The 3 columns are the only way all this makes sense. Nothing else helped me. Thank you, Patty. I appreciate you saying that. I'm sorry that other things didn't help, because if they did, people would be a lot better off. But I'm very glad that the columns are providing relief for certainly many people in the population are finding it makes more sense. It sometimes can take some time to figure out, well, what do these columns mean? But I have it boiled down to its essence. I can get it to you very, very quickly. And happy to talk about it. I just want to make sure to get questions in before we wrap up for today. We may have to do that next time. Okay. Joseph then says, Dr. Dan, I have observed that the talk of, quote, emotional needs in the space can make people think they need all their, quote, emotional needs met in order to get better. I think this just creates doubt for people. 100%, Joseph, 100%. I call this beating your head against the emotional brick wall. It also is, it does drain people of hope. If you're supposed to get all of your emotional needs met, well, we're realists. We understand that's not easy to get met. The good news is it's wrong. The main thing that needs to get smoothed out is doubt. You can have your emotions. That'll lead to emotions column symptoms and some flare-ups, but you can master those. You can make them go away very, very quickly. Okay, Tula says, so when I overdo exposure training or stuff my anger around divorce, I go into biological fight or flight quickly and then sleep 12 hours. So how to not feel its dangerous nerve pain, adrenal burnout? Okay, well, I guess the first thing I would say, Tula, is that you have a potentially logical idea about it. You're saying, well, I probably would burn out on this as I'm going into biological fight or flight mode. But first of all, I'll tell you from personal experience, if so many people are able to reverse their symptoms on a dime, that has to tell us something about how this system actually works. I know it's not happening for you that way, and it doesn't happen for most people that way. So I'm not saying there's anything wrong that that's not happening, but the fact that anyone can do it at all tells us that adrenal burnout is not likely to be a thing, because if it was, that should be happening to everybody. So what do we, I think as scientists, it's got to fit with everything that we need to that we've seen before. If we're going to be good scientists, we can't put any information away. So I want you to think about, what does it mean that some people can have all of this anger and stuff and be in fight or flight for years, and then you hear these stories of they got the aha moment and it turned around. What does that mean? So to use that information, let's think about that. And of course, if you need to have more of a conversation with me, please send me an email, dan@crushingdoubt.org. Okay, Elizabeth Baggage says, thank you so much, Dan. I will look at your webpage to find it. My pleasure, Elizabeth. I'm sorry I couldn't remember it offhand, and I'm not sure why the website wasn't working, but we'll get it back up and running. Teresa says, I have a friend in her 50s, and she has so many issues, stress from work, caregiver and people pleaser, and takes hardly any time for herself, etc. Always running to the doctor. I have been there. However, now that I'm on this journey, I'm so much better. A lot of this is about how do we learn to take care of ourselves. That's power column work, by the way. These columns will make more sense. They're very, very simple ideas that can give you a sense of how to think about things. I'm going to finish up on this. Joseph has a couple of things to say here, and we'll finish up here. Yes, Dan, I was referring to people to challenge their pain and face the backlash of increased symptoms. Yes, this is due to deep beliefs that movement isn't safe. I was speaking of medicine to support this safety being created while TMS is being challenged. Yeah, any way that you can create more actual safety for yourself, go right ahead. 100%. Ultimately, this is about bringing down that fear. I can also say that when I was very bad, I did take downer meds that did absolutely nothing. Interesting. I had the same experience, by the way. Medication alone does not do anything, but I do think it can help if used strategically with the personal work. So I agree with that. I also think sometimes, interestingly, using the medication simply provides less fear by itself that you are doing it. So sometimes it's the fact that you are getting that relief that can help. So Joseph says 100%, percent. So I'm glad you agree so much. It's been a pleasure, guys. Thank you so much. Jane Smith says, thanks again, Dr. Dan, and wishing you a happy birthday. I appreciate it, Jane. I will try to enjoy it despite my increasing years, even though I'm pretty young still. Guys, it's a pleasure. I do want to remind you, we're making a move next week. So we're moving to Thursdays. It's the same time, 6 p.m. Eastern, 3 p.m. Pacific. We're going to move there for good. Part of the reason for that is that I have groups on Mondays and the Q&A. And this will allow me to, keep focused on the questions in a way with even better energy, I hope. So Thursdays now, 6 p.m. Eastern, 3 p.m. Pacific. And Armand, I see that you have a question here. What I'm going to do is put that in the preloaded questions for next time, because we're out of time for tonight. But you also can email me, dan@crushingdoubt.org. Again, if you want the basic information, we've got pre-recorded seminars. I'm revamping the seminars to be ones that can be done over a 2-day period, which will be easier for people to schedule. So more help is on the way. The groups are always there. As I said, that's Mondays at 4 p.m. Eastern, Wednesdays at 12 p.m. Eastern. Fridays are currently at 12 p.m. Eastern. We may be making an adjustment to 2 p.m. Eastern. I'll get back to you all on that. If you sign up for our newsletter, you can have all that information. Armand, I'll get your question put in. Tula says, thank you and happy birthday. Thanks so much. And Karen Essex, I didn't mean to elicit all the happy birthdays, but I do appreciate it. Guys, this community is the best. Let's keep it up. We will keep getting everybody relief by getting the questions answered. When it makes sense, we get less afraid. Thanks so much, guys. Take care.